Thank you for joining us for today's webinar about Ponce Health Sciences University Medical Program. My name is Chantal Perez, and I'll be your host for this session. As many of you may know, PHSU has a long-standing reputation for excellence in healthcare sciences education. With over 45 years of experience, we are dedicated to preparing healthcare professionals who are ready to make a positive impact worldwide. Our main campus is in Puerto Rico, but we are excited to expand and reach out to other parts of the world. So we are internationally with our campus in Tortola, British Virgin Islands. Our medical program is designed to offer a world-class education focused on quality, innovation, and student support. We aim to provide students with knowledge and skills to become not only successful medical professionals, but also compassionate leaders in healthcare. This program offers an integrated curriculum that combines rigorous academics with hands-on clinical training, helping students develop critical thinking and practical skills essential in today's healthcare environment. Today, our Dean of Admissions, Dr. Sarimer Sanchez, is with us. She will give you a comprehensive overview of our medical program and share important insights into the admissions process. After her presentation, we will open the floor to questions, so please feel free to share your questions in the chat at any time. So let's begin by welcoming our Dean of Admissions, Dr. Sarimer Sanchez.
Hi, good afternoon, everyone. As mentioned, I'm Dr. Sanchez. I am an infectious disease physician. I'm a practicing clinician here in Puerto Rico and the Assistant Dean for Admissions for PHSU School of Medicine. I'm very excited to talk today. I'm going to start sharing my screen about tips for entering medical students and thinking about success, not only in the application cycle, but importantly, tips for success in medical school, which is ultimately the goal. So let me share my screen and start the presentation. Please confirm that you can view my slides.
Yes.
There we go. Looks good?
Perfect.
Excellent. So again, welcome. Very excited to welcome you all on your journey to applying to medical school. I'm going to walk through each of the different components of the medical school application. Many of you are already well through the application process, but I do think that really understanding how we as a school are looking at applications and in general, how medical schools, look at applications will be a very helpful tool to prepare you for submitting applications in case you still haven't applied, for interviewing, and really for, again, the whole process. And then at the end, I'm going to bring it all together and talk about what would make a competitive applicant for our school at the British Virgin Islands in Tortola. So I think we can all agree that in order to be a physician, a person needs to have a very diverse set of skills and personal and professional competencies, right? Being a physician requires extensive grit, resilience, adaptability, requires someone with a strong sense of service to help others, requires someone who can communicate well with patients and families and other professionals in the healthcare system, etc. And so a lot of my resources today are derived from the AAMC. The AAMC has developed a set of pre-medical competencies for entering medical students that really summarizes what are the skills and competencies that are really essential for success in a medical career, and that includes medical school. And they divide this up into different set of professional, thinking and reasoning, and science competencies. So thinking about service orientation, cultural awareness, social skills, all very important, again, for interacting with patients and families and with others in the healthcare interdisciplinary team. Resilience and adaptability, certainly important for getting through those long shifts and those long nights of studying in medical school. critical thinking, right? Putting all of the different pieces together in a diagnosis, in an assessment of a patient in the emergency room or wherever you might encounter them, and really thinking critically about different diseases to devise a treatment plan that is essential for any physician. And then finally, thinking about the essential science competencies, the knowledge that is really important to build the foundation for medical school, right? Biology, chemistry, mathematics, all of those underlying principles that will help you to synthesize the different anatomy, microbiology, and other core sciences that are essential in medical training to understand the human body. So these are essentially a part of the pre-medical competencies that many medical schools use as they holistically review applicants, and this includes our institution. So what is holistic review? So many of us often focus, and importantly so, on the academic pieces that are essential to medical school application success, getting good grades, a good GPA, a good MCAT. However, we know that a candidate's readiness for medical school is not just in the grades, right? As I mentioned, you need other lived experiences, attributes to be successful in medical school. And holistic review is a framework where schools consider not just an applicant's GPA, not just their MCAT scores, but their capabilities and consider their life experiences, their attributes, and their academic metrics in conjunction. Many medical schools are now using mission-based admissions. So each medical school has a mission statement. And you can really get a sense on their mission statement on what they value in future medical students, right? And that can be used to help you prepare for your application and interview, to really help you highlight how your experiences make you a good fit for our school. So for example, at PHSU, we are focused on delivering an innovative and culturally competent curriculum to train ethical and compassionate healthcare practitioners, right? And so really thinking about those pre-medical competencies that we just mentioned, cultural competency, a strong sense of ethics, really having compassion and service. Really mission-based admissions can help you understand how admissions offices are thinking about applicants. And I'll talk a little bit more about this. And so as I illustrate the different parts of a medical school application, really the question that you should think about as your guiding question is, what about you as an applicant? And what are the different components of your application that illustrate resiliency, service, and or any of these pre-medical competencies that your school is looking for, right? What are the different parts of your application that you are able to bring out that you have these pre-medical competencies, that you've shown them via your experiences, via your leadership in student associations, via your community service, shadowing, etc. So you're always really going to think about how each of your application components is illustrating those pre-medical competencies. And so the AAMC also has an experiences attributes metrics model that has become a pretty dominating model when it comes to thinking about medical school applicants. So as you can see, in the center of this model is what many of us consider traditional criteria for medical school acceptance, right? Academic excellence. So your MCAT scores, your grades, and your GPAs. But this model is really built on widening that lens, right? Really thinking about what are the attributes of you as an applicant and the experiences, the world events, the community service, the research experience, the personal background, your own life experiences that have really prepared you to be a physician and a future medical student. So this model really builds to expand upon the traditional metrics, and again, hone in on the different life experiences that illustrate these pre-medical competencies, as I mentioned. So what makes, I'm gonna talk about each of the different components of the application, but what makes a competitive applicant? And I'm gonna talk about this, hone this in at the end. One, it's going to be a good time management skills, right? So are you able to balance many competing deadlines, keep focus, and prioritize when necessary to complete tasks on time? Have you shown leadership throughout your pre-medical studies and throughout your pre-medical journey? Have you gotten exposed to medically related environments? Do you demonstrate that you're able to communicate well? And importantly, in your application, do you demonstrate alignment with the medical school mission and pre-medical competencies? So as I talk about each of the different components of the application, I always find it helpful to stress that there are many resources out there to inform how you approach your medical school application and to prepare for applying to medical school. So if you have any pre-medical advisors at your undergraduate institutions, if there are any health professions fairs, you should attend them. You should prepare early on, get advice from your mentors, and specifically about if you're earlier on in the process, how to complete your coursework at your school, ideas for shadowing, internships, etc. But if you're already applying, get feedback on your application, have someone double check your essay, get feedback on what to include in your experiences. And finally, in getting ready for medical school, which is obviously the goal. And so the medical school application process that I'm going to go through, this is an overview of what we're going to discuss today, briefly for each, but I'm going to walk through the required pre-medical coursework, how we're approaching academic performance, and letters of recommendation, personal statement, and experiences. These first 5 bullets are often what many medical schools use to pre-screen applications to determine who is invited to interview. Then we will talk about the interview process and how to prepare for it well, and what are admissions committees really looking for as they evaluate your application as a whole. Okay. So first of all, I mean, again, depends on where you are in the process, but I would say that be sure each school has their own set of required pre-medical coursework and credits. Broadly speaking, in the table on the right, most medical schools require, similar subjects, because the understanding is that each student needs a broad-based preparation in sciences and math, as well as in humanities, to really be a good doctor, right? I mean, ultimately, you all want to prepare yourself for success in medical school. And these are the courses that we believe will provide that strong foundation for medical school success. And so our requirements at the BVI are very similar to those in other institutions, include 8 credits in biology, 8 credits in chemistry, 8 credits in organic chemistry, 8 credits in physics, 6 credits in mathematics, 6 credits in behavioral and social sciences, and 3 credits in English. And so again, very similar to what other institutions have, but obviously if you're applying to other schools, you really need to make sure to familiarize yourself with each individual school's requirements, which are often on their admissions webpage. Next, the pre-medical coursework, as well as your general coursework, you will have a set of GPAs. Many schools often look at your cumulative total GPA, which includes your academic performance and grades for all of your courses. And then many schools are also looking specifically at your science and math GPA. And so considering your grades only in science and math courses. There are a few other things you need to consider. Does your school only count undergraduate courses in the total and science GPA? Are graduate courses included? And so these are some of the questions you might have for each school's admissions office. And then a big part of academic performance is an MCAT score for many schools. So you should determine if your school requires the MCAT, and if so, what is their minimum score requirement? And do they take your highest score? Do they take your average score? Which one is it that they're looking at? So those are all different components of a school evaluating your academic performance on your application. And importantly, the other component is the MCAT, the Medical College Admissions Test. So this is you all know what the MCAT is, I presume, but it is a standardized exam offered for applicants in schools in the United States and Canada, designed to assess your problem-solving, critical thinking, and your knowledge of core science and social concepts. The important thing I like to highlight is the second bullet point. Preparation with pre-medical coursework alone is not sufficient. The MCAT, doing well in the MCAT requires you to take the test well. And that requires a lot of practice, practice, practice. There are many different resources out there that I've included. MCAT Official Prep Hub, which is a part of the AAMC, has many practice questions, has section banks that you can use. The more that you practice, the better. That's often what I recommend to all of my mentees. And as you'll see here on the table on the bottom right, over a third of medical applicants take an MCAT preparation course. So, it is something that you need to prepare for. Again, not just having taken the required pre-medical coursework in college, but really preparing for the exam itself, I would say, is really important. And for the BBI, an MCAT score is required for applicants from the United States, including U.S. permanent residents. It is not required for international applicants. A big component of an application, and actually one that an admissions committee is going to look at and really weigh in terms of how strong an applicant seems to be and their fit with a medical school, is the letters of recommendation. Most schools require letters of recommendation. We require 3 letters of recommendation, 2 of which must be from professors. We also accept pre-medical committee letters because we know that some schools in the United States have pre-medical committees, and this is an acceptable alternative to the 3 letters of recommendation. But you really need to look at each school's requirements. I would say that letters of recommendation, what we want out of them is we want to know, a little bit more about who you are as a student and who you are as a professional, right? We want to know your commitment to the sciences and mathematics, for example, in terms of your pre-medical coursework, for those letters that come from your professors. We also want to know, are you a good team player? Do you get along well with others? Are you engaged in your classes? Are you a leader? Can you be counted upon for, research, for tasks? Do you follow through? And so, you really should ask for letters early from people who can speak well to who you are. There are different guidelines that the AAMC has that you might want to share with your letter writers, who you ask to write a letter of evaluation or a letter of recommendation, because these guidelines help them to understand what a school really wants to know. So, for example, explaining how your recommender knows you, including information on, on experiences that that they've shared with you, or how they've observed different attributes in you, describing how long they've known you, all of these different any challenges that you've overcome, or stories that might speak to those pre-medical competencies that we were talking about earlier, critical thinking, communication, teamwork, reliability, resiliency. So really being able to kind of these are some of the competencies that your letter writers might want to bring out. And again, these are documents that are easily available online. And so, when you ask for a letter, don't shy away from including some of this guidance to your letter writers. Okay. And then another important component in this checklist that we're going through is a personal statement. So each medical school really wants to know, in addition to your CV, to your academic performance, to your different experiences, we want to know who you are, right? And I think that's a really important thing to keep in mind, is we want to know you as a person, not just you as a number, not just you as a medical school applicant, who you are as a person and why you want to be a doctor. That's really kind of the guiding question. And so the personal statement, I would say, start early and use it as an opportunity to reflect. Again, reflect back on those pre-medical competencies and reflect back on your commitment to medicine. And help us, in a statement, either describing experiences, describing, your journey, help us get to know you and your unique journey to where you are right now applying to medical school. Let us really be able to get a sense of what are your true goals and values. What's your true self? You might help reading other sample personal statements online. Sometimes reading other personal statements can give you ideas for the types of storytelling, the types of different models that might help you tell your story best. Again, this is an opportunity to really stand out, Doesn't need to be over the top. It doesn't need to be an elaborate story or something, but just make your own authentic voice shine through. And I think really helping the admissions committee understand why medicine is really important. And if you're able to even better to say why that school, that's even better as well. Okay. And then there's an important piece of your application where you're going to describe your experiences. For many schools, this is often can be in the CV or in the resume, or each application might have a section where you include the number of hours and experiences that you've had in volunteering, in community service, in shadowing, in healthcare related experiences, research, and you might also include personal experiences, right? Many applicants we often hear have to be caregivers for family members who are facing an illness, and those often can be insightful experiences that help them understand why they want to be a doctor. So really thinking about what are the different experiences that you've had and being able to describe them, and what are the number of hours that you've dedicated, what are the skills that you've gained. These are also great experiences to be able to talk about in the interview, which I'll get to in a minute. But thinking about how these experiences have prepared you to be a good physician and to be a good medical student is really important. And so all of these different components of the application that I've described, your grades, your coursework, your MCAT score, your letters of recommendation, your personal statement, and your experiences are pre-screened by an admissions office to determine who is going to be eligible for and invited to interview. And so this is the next part of proceeding in your medical school applications. Now, the medical school interview is essential. It is a very critical tool that will help admissions committee evaluate a candidate's professionalism above all and their fit with the institution, as well as assess some of the pre-medical competencies that I discussed earlier. There are many different interview structures and interview formats, and so it's going to be really important that you familiarize yourself with your school's interview structure and format. So for example, there are one-on-one standard interviews where you are paired with an interviewer and they ask you a series of questions. There are group interviews where rather than being yourself with an interviewer, you might be with other applicants and they're interviewing you at the same time. There's also the format of multiple mini interviews where you have multiple interviewers and you are rotating across different interviewers and short questions. Some interviews are in person and live. Others are virtual and live, meaning they're occurring at the moment. Some interviews are hybrid, meaning a part of the interview might occur in person and a part might occur online. And then there are virtual interviews that are asynchronous, where sometimes a medical school will give you a prompt and ask you to record yourself answering a question. So it's really important for you to prepare yourself and to know which format your medical school is using. For the BVI, we are currently using a live virtual one-on-one interview. So you're going to have a live interview paired with a one-to-one interviewer. Okay. And again, the medical school interview is just another piece of the application where you can really illustrate what are the pre-medical competencies that you possess and how you prepared yourself to attend medical school. So depending on the questions that they're asking you, they might want to know a little bit more about your resilience, right? How you've faced challenges in the past, how you can adapt easily to changes, how you think critically. They might want to know about your cultural awareness and cultural competency and ask questions designed to help assess your cultural competency. They might want to know how well you work in a team, right? And ask you situational questions geared towards teamwork and collaboration. And importantly, with any interview, they want to know how you communicate, right? Are you able to communicate effectively and well? Are you able to answer a question completely and to communicate with respect and communicate clearly? So these are the different pre-medical competencies that, as part of an interview, depending on the questions that are selected, a medical school might want to know. Okay. And I would say, again, there's many resources out there to prepare yourself for interviews. The AAMC has an interview preparation guide that will walk you through in detail how to prepare ahead of the interview and what are the classic interviews do's and don'ts. They'll also have different sections of their website dedicated to the different interview formats. So many schools use the multiple mini interview format. For example, the AAMC has a section on that. In general, as part of your interview preparation, you want to understand what are the different typical question format. So general questions that are asking you a very direct question, such as why you want to attend medical school. A situational question, which is asking you, in this situation, if you were facing this situation, how you would respond, and a behavioral question that's designed to get a sense of how you've faced change in the past, how you've faced difficult situations in the past, right? How you have behaved in the past and what you've learned from that. So really do your research is what I would say to prepare yourself. Read your school's mission statement and values and make sure that, if you're asked the typical question of why you want to attend, for example, the PHSU BVI, make sure that you've read about our school, that you've read our mission statement, and that you can speak to why you would be a good fit for our school. Practice your responses ahead of time. Again, practice interview questions and practice how you would respond to them. I would say that similar to the personal statement, and in general, as part of the application process, identify key experiences that you've had that you think can really speak well to how you're prepared to be a good medical student and how you can contribute to the medical school. And importantly, I always say, the interview is not just for you to demonstrate your fit with a school. It's also for you to assess whether the school is a good fit for you. So it is always important to prepare questions for the interviewer that you have about the school. It also shows that you're serious about a school and that you're really truly interested in the school. And again, really trying to make sure that it is a good fit in both directions. Okay, so always have at least 2 or 3 questions that you're going to ask the interviewer. And ideally, really think about questions that answers are not immediately available online, right? I think about authentic, true questions that you would have about the school. After you are interviewed, typically then your application as a whole, including your interview report, is brought to an admissions committee. And so our licensing boards and accrediting boards require an admissions committee to be a part of the admissions process. And so the responsibility, the ultimate and final responsibility for accepting students to a medical school rests with a formally constituted admissions committee. This often consists of faculty, administration, and medical students who are a part of the school community. And the admissions committee, each admissions committee will develop their own standardized process to evaluate applicants for the attributes, experiences, and metrics that are essential for entering medical students. So again, bringing this back to they are going to perform a deep dive of your application to determine how each of the components of your application align with the pre-medical competencies that they're looking for as part of their mission. So again, this is where it all comes together. Our admissions committees at the BVI and PHSU use a set of competencies and selection criteria such as academic performance, commitment to a career in medicine, communication skills, critical thinking, cultural competency, ethical responsibility, humanism, integrity and maturity, language and communication skills, leadership, professionalism, resilience and adaptability, service orientation, and social skills, right? These are the competencies that we are going to be evaluating as we look through your application, and really wanting to make sure that you demonstrate, right, that you illustrate that you align with these competencies and that you have what it takes to be a successful medical student. So it is going to encompass a very detailed and holistic review of your application as a roadmap to who you are, right? So reading your essay, reading through your different experiences, reading your letters of recommendation, reading through what your interview report or performance was, and academic performance. And again, the goal is to bring this all together to understand who you are, the experiences that have informed your commitment and preparation for a career in medicine, your leadership, your resilience, your adaptability, and your fit ultimately with your school's value. In our case, your fit with PHSU BVI, right? We want to know who you are and do you seem committed to a career in medicine and do you seem to be a good fit for our school? And so kind of closing out this webinar, kind of answering the $20 million question, as I would say, what makes a competitive applicant for our school, for our PHSU BVI School of Medicine? So, again, bringing this back to our mission of educating culturally competent, ethical healthcare practitioners who can practice compassion and empathy with patients and be leaders in research to address health disparities, right? We're looking for an inaugural cohort of medical students, right, who can thrive in a new medical school, in an international medical school that might be far away from your sources of family and social support, right? So who do we think would thrive at the BVI, right? We believe that candidates who are really truly committed, who really want to be physicians, who are resilient and who can adapt to changes, to being in a new inaugural cohort at a medical school, who demonstrate leadership and proactiveness, who are culturally aware, who have a strong ethical responsibility, who can communicate well and who are highly professional, who have excellent time management skills. Again, this is crucial for any medical student. And then again, those who in these competencies demonstrate that they are a strong fit for the PHSU BVI School of Medicine, or really for any other school that you apply for. But these are particularly the qualities that I believe make a competitive applicant to our school. Because ultimately, what we want is we want you to thrive, right? We want you to be successful. We want you to be successful in your journey towards becoming a physician. And these are the skills and qualities that I believe are essential for any medical student to really be successful at our school. Okay, and so we thank you. I'm going to pause here and bring it back over to Chantal, and thank you all for joining our webinar. Thank you.
Thank you so much, Doctora. Thank you. It was such an informative presentation. As we wrap it up, we would like to go over a few key questions that might be on the minds of the prospective students. So I have here, what unique opportunities do PHSU medical students have on the Tortola campus?
That's a great question. I mean, I would say that it's in of itself a unique opportunity to be a part of an inaugural medical school cohort, right? I think that it is an opportunity to really lead and innovate as a student in terms of really setting the path for future medical students, in terms of student associations, in terms of engaging with community, in terms of thinking through what are the different, student organizations that we will need. What are the different ways of, again, engaging as we think about health fairs, as we think about branching out and really establishing ourselves in Tortola. Really our inaugural cohort will have a very unique opportunity there to really be proactive. Also studying with different medical students from peers from around the world. I think it's a very unique opportunity to have a diverse set of peers. You learn a lot from your peers. And so I think that in of itself is something that I think is also a really important, unique opportunity.
It gives you perspective.
Mm-hmm.
Can you elaborate on the types of clinical experience available throughout the program?
So that is a great question, and obviously we are still in the process of establishing these, the clinical experiences. What I would say is that for the third and fourth year, particularly, which is where students have the most clinical experiences, we have secured agreements with hospitals across the United States, in New York, Florida. We also have our own rotations in Ponce for those who speak Spanish, and in St. Louis. And so we expect to have a diverse set of clinical opportunities and rotations for our medical students to be able to, particularly to transition to the US system, which I know is a huge goal for many of our applicants.
So I have another one. What are some of the key qualities or experience you look for in a prospective student during the admissions process?
So that's a great question. So again, we're really looking for candidates who are committed to a career in medicine, who have demonstrated that commitment, who have persevered in that commitment, students who are resilient and adaptable, who are leaders really, and have demonstrated that they can communicate well with others, can work well with others, and have leadership. I think those are some of the essential qualities. Obviously, we want students who will be successful again in an inaugural cohort at a new medical school, and those are some of the key qualities I would say are essential for success, who are well organized, and who are really disciplined.
Okay, thank you so much, Doctora. If anyone has any questions, you can write them here in the Q&A. We will be so glad to help you out. No questions to the moment. I'm surprised. They're usually very curious.
I give a lot of information, so a lot to
Yeah,
think
I
about.
think all the questions were answered, I think. Let's see, I'll just give it a minute. Okay, so no questions at all. Please know that you can contact us at, well, myself, that I'm an admissions officer for PHSU BVI, and I can help you out with any questions that you may have in the future. I'm gonna write down my direct email so you can all have it. Also, on the PHSU is gonna be having a campus tour on January. Please feel free to ask about it. And if you want to come, you're more than welcome. Okay. Let me see. 1 minute.
I think I just saw a question come up.
Yeah, great. It says, would nursing be considered as an experience that counts in the application for people that didn't really volunteer but did work in the field?
Definitely. I think it's a very, very important type of preparation. And so I would definitely count that as a very valuable experience because you are essentially demonstrating that you are in a healthcare related field, providing patient care. I would say that's an outstanding experience, and I would definitely highlight it in your application. Okay.
Okay, here's another one. How important is volunteer work on applications, even ones not directly medical related, Salvation Army, disaster relief, etc.? Will that still be worth investing in to show students have a practice of empathy and care?
Definitely. I mean, again, I think your application is a window into who you are, right, and what you value. If, for example, I often have applicants that say in the interview that they really value service. Well, I'm going to be, as an admissions committee member, looking for what are the different areas of their life where they've shown that demonstrated commitment to service. So it really, I would definitely say that there are many valuable volunteer experiences that are not necessarily directly related to the healthcare field, that can really show your sense of service to others and that translate to kind of having that empathy, to having that dedication to helping others that is essential as a physician. I would say that each applicant, right, has to think about the different ways that they're going to invest their time, right, to be successful, to be successful in their journey. And so I would say, if you're considering volunteering, do something that really speaks to you, right? Because I think ultimately you want to do something that you're passionate about, and that will show, right? I can always tell when I'm interviewing someone who's truly speaking from a place of enjoying what they do and passionate about what they do, than someone who maybe just did it to check a box for the application, right? That can be quite obvious. And so I would say, as you select kind of where to invest your time in activities that really speak to you, have a balanced application, and obviously also make time to study for the MCAT, to study for, to have good grades. It's all a balance. But I would say that there are many excellent volunteering opportunities that are not directly related to the healthcare field. And if you do those, then maybe have a few other experiences where you do show that you've exposed yourself to a career in healthcare, and that why you want to be a physician. Because I think that's the other piece, is where you demonstrate that commitment to the career in medicine. Okay.
Okay, we have another question. Is there any financial aid or scholarship for students from PHSU MSMS program? Yes, we do. Yes, we have a scholarship for the MSMS students to MD. You
Yes.
can find it, I think, it's on the website, but we do have it. Okay, another question. No, apparently not.
Oh, those were great questions.
Yeah, they were. Okay. Well, if no more questions, it appears I can't share what I'm writing for some reason, but no worries. I have the attendees list, so I'm gonna send each and every one of you. Oh, there it is. That's my email. Thank you so much. And I'm gonna send some details on the email, okay? Well, thank you so much for joining us today. We hope this session has provided you with a clear picture of the exciting journey PHSU offers in medical education. Please feel free to reach out if you have further questions, and we look forward to seeing you on the campus soon. Thank you so much for being here. Thank you, Doctora. Have a great day. Happy holidays, everyone.
Happy holidays.
Bye.